So why don't we ask somebody who might give us a straight answer? David Shulkin served as Secretary of Veterans Affairs in the first Trump administration, and he was appointed to that job after serving as Undersecretary in the Obama administration. He's a renowned private sector hospital administrator who is credited with dramatic turnarounds at massive healthcare organizations. So it is perfect that he joins us now. Okay, which is it, Mr. Shulkin? Is it because of Obamacare or in spite of Obamacare?
You know, what's really clear is this healthcare system is broken, and the real issue is affordability. Americans are increasingly unable to afford the healthcare plans that they have. And the problem really is that since Obamacare, we've not had a look at national healthcare reform. And so this is a problem that, frankly, the Republicans have not proposed a plan that's going to make healthcare affordable, and the Democrats haven't proposed a comprehensive reform plan. What we see are continued Band-Aids, which are in the form of these subsidies, to try to make health care affordable, but it doesn't make it affordable for everybody. And clearly, without these subsidies, we're going to see a large number of new uninsured Americans starting in 2026.
Well, you have set up my next question and this graphic very perfectly. I was stunned to learn that there are almost 24 million Americans who are covered through these exchanges. I want you to take a look at the analysis from the Kaiser Family Foundation that forecasts what will happen to premiums if and when these subsidies expire. You see there that down in the right corner, middle-class beneficiaries over the age of 60, that's a monthly spike of $851. I get why Democrats chose this as their place to fight. But to your point, there's got to be something very wrong with the way the system is working, if that's even possible. What's the matter? What is the matter that these huge cost increases are going on? What's the problem?
Well, the problem is that the cost of healthcare, the cost of providing it, the cost of the pharmaceuticals, the cost of being hospitalized just continues to increase, and Americans essentially are getting sicker with the chronic illness that's out there. So without being able to provide preventative care, without being able to address the reasons for why chronic illness is essentially out of control, we're going to continue to see these healthcare cost increases. But what we do know is that if you take away healthcare, or if you force more people to lose their health care so they become uninsured, that not only delays the type of care that needs to happen to be able to get these costs under control, but it also raises the cost for the rest of Americans who do have insurance. Because when young people or healthy people choose not to be insured, they leave the insurance pool, and those are the less sick people, so those that remain have higher costs to share. And so we're actually headed in the wrong direction. Rather than looking at comprehensive health reform, changing the model of healthcare in the United States, we're actually going to be increasing the costs, because uninsured essentially end up in hospitals, they end up in emergency rooms, and that cost is shared by everybody.
Dr. Shulkin, the last thing is some of this just because medicine has allowed us to live longer and people are older, and the most expensive time in your life for healthcare is when you are, the reason those premiums are so high over 60 is that there's just so much more medicine can do now than it could 40 years ago?
I wish that was the case, and clearly over the last 40 years, that would not be inaccurate. You know, we've made great advances, but unfortunately, in the last couple of years, we've not seen that continued increase in life expectancy. In fact, we've seen a decrease, and this is because of, COVID-19. It's because of other illnesses. It's because of all of the pandemics that are all of the issues related to overdoses and substance abuse and mental health. And so we're actually beginning to see a decline in the life expectancy in the United States. And so just by adding on more costs doesn't mean that we're making improvements. This is really a time that we do need people to come and to sit down and to figure out a better way of delivering healthcare, a better way of pricing healthcare, including pharmaceuticals, And simply to make this into a political issue and have a government shutdown over it isn't going to get us to where we need to go. We need both sides talking about the real issues here to solve this for Americans.
Well, Dr. Shulkin, we thank you for doing that with us here today. You're a mensch.